Good evening, everybody. I'm going to give this a little bit of time for you to get into the room before I get started. Well, I'm Reg Hoyt. I'm the co-chair of Animal Biotechnology and Conservation, and welcome to our first One Health seminar of the spring semester. As you probably already know, we have six seminars every single semester, and this is actually our sixth full year of doing One Health seminars. I hope you've had a chance to join us in the past. For those of you who have not joined us in the past, and you're wondering what is One Health all about, well, I guarantee you that our speaker tonight, Dr. Cheryl Stroud, is going to tell you a great deal about One Health, but I'll tell you a little bit about One Health at DelVal. Basically, the concept that we are promoting here is the recognition that we're all in this together, that we only have one planet, and that all the components, all of those organisms and the environment of the planet are interacting with each other in either positive or negative ways. And certainly it wouldn't be too hard for us to understand some of the negative ways that we've been impacting the planet. At DelVal, we've got a One Health working group, which is composed of faculty and staff and students, and working towards trying to promote this across the entire campus for all majors, not just for those who may think they're animal science kind of people or whether environmental people, but everybody, because we're all kind of in this together. We do this in a variety of ways. One way is through our coursework. So many of us will, throughout our careers, have been kind of making these linkages, indicating that, you know, we're all inextricably linked here, but we don't explicitly use the term One Health. I think that the One Health term is extremely important. It kind of indicates that, you know, all of the courses that you may take within your programs are actually interlinked, and that whenever we're trying to deal with a problem, we need transdisciplinary approaches. I'm a biologist working in wildlife conservation, but I have to understand societies. I have to understand economics. And this is true for every single problem that may exist, that you've got to kind of hold your hand out and say, somebody help me. We've got to approach these things from different points of view. Another way is through research, trying to encourage, you know, interactions between departments, whether it be student research or faculty research. And then there's outreach. And that's what this is all about tonight. These seminars are intended for our community as well as for the university itself, our staff, our faculty, our students, but for the people who are in our community and well beyond. And so, you know, if you're interested in what this is all about, or maybe about what the seminars that we've had in the past, you can go to the website that's down there below, delval.edu/onehealth. And you can see past seminars, and you can see a video on One Health. I'll put that in the chat, along with also a linkage to our library resources, which Claire Drollett from the library has done an enormous amount of work pulling together information that would certainly meet probably anyone's needs. There's so much of it there. I'm going to stop at this point and introduce our guest this evening, and I'm really pleased to have Dr. Cheryl Stroud with us this evening. Cheryl has done some amazing stuff, and I like the track of her career because it's kind of a really One Health in the nutshell. She has been in industry, she's been in academic research and teaching, she's been in private veterinary practice, and she's certainly been a One Health practitioner, as she's currently the executive director of the One Health Commission. She's got both a DVM from Mississippi State and a PhD from North Carolina State. And she did some basic research at our own neighborhood here, the Penn State University, and got her foot kind of in the water here of One Health by being a veterinarian working in an anthropology department. So that's truly this transdisciplinary approach to the things. In addition, she helped in 2010 to form the North Carolina One Health Collaborative and facilitated the collaborative creation of her interinstitutional One Health course, which still exists, been 10 years running with Duke, University of North Carolina, and North Carolina State. As executive director of the One Health Commission, primary focus is in education, kind of what we've been talking about, locally, nationally, globally, about One Health and the One Health issues. And so connecting One Health stakeholders into action teams, creating strategic networks and partnerships. And one kind of component here I really like, besides, doing it at all levels, academia, policy, research, government, but One Health as our ray of hope for the future. And with that, I give you Dr. Cheryl Stroud.
Thank you so
Welcome.
much for that kind introduction. I bring you greetings from the One Health Commission, where we really work very hard to connect One Health strategic stakeholders, create teams and networks that work together to educate about One Health and One Health issues. So I have a lot to say. I'm going to talk fast. I told Dr. Hoyt that I'm happy to provide these slides afterwards as a PDF so you can grab some of the links, because I have a lot of links that you might want to go and check out for the things. So hold on to your seat. I'm sure that some of you are very familiar with One Health. Maybe some of you are not. So hope something that I say here tonight is going to be useful for you. I always like to thank all our sponsors. We could not do any of the things we do without them. So thank you to all these wonderful sponsors. What I'd like to do in our time tonight is, of course, talk about what One Health is all about and really bring beyond zoonotic diseases, the full scope, a lot of the other arenas that are just begging for this one approach. We'll talk about some examples of cross-professional collaborations, and I hope throughout this whole talk, you'll get a feeling for why this is so urgent. So here's my take-home message. There is no one profession that can know everything. We need to collaborate. We need a lot of collaborations. Those collaborations we need are not just magically going to form in our current systems, because our systems have pushed us into silos. So for the collaborations to form, they're going to have to start with relationships. And those relationships are not going to form unless we are aware and actually reach out and try to form them. So that's the take-home message. Collaboration starts with relationships, and we have to sometimes step out of our comfort zones to try to help those relationships form. So One Health is, I don't need to probably give you a definition. I know you guys are hearing this from your campus, but this is a handful of logos from groups all over the world that are working now to really further this. And we'll talk a little bit more about that. So we're really talking here today about how inextricably interconnected we are as humans with our animals, the ecosystems, the environment. You cannot tease us apart. You cannot talk about one without the other. But it's not a new concept. We're actually resurrecting an ancient wisdom that many indigenous populations still have kind of grounded in their DNA. But it is a new professional imperative. So why is that? Why do we need One Health? Because really, truly, if you think about it, our systems have forced us into silos. Our academic tenure processes don't really necessarily reward cross-disciplinary work. If you don't research and publish in the most elite journal for your particular tiny little area, you don't get as many brownie points when it comes tenure time. Our government agencies are in silos. We can talk about that for hours. Research at the industry, and industry is very proprietary. That research has to bring a return on expenses and investments, and they can't do that if they share their secrets. This one really gets me. Our publication systems have pushed us into silos. Most research all over the world is done based on public dollars. It's funded with public dollars, tax dollars. But for many, many, many years, that research would get published in journals that belong to associations, and only people who are members of those associations could have ready access to it. And this is still a problem today, although open access is helping us along quite a bit. We just have to be sure that we keep the quality up. And then the one that's probably most silly, but can be very profound, is our language barriers. And yes, it is a language barrier that I can't talk to the One Health Latin America group because I don't have Spanish, but also silly little things like being concerned to go talk to somebody in another discipline because they might use an acronym that you don't know, and you'd look dumb to have to ask, now, what are you talking about? Especially for the older generations. So we have a number of things that have kind of pushed us into silos. That's why we need One Health. And if you think about it, way back in 400 BC, Hippocrates was talking about airs, waters, and places. And in the late 1800s, I'm sure you guys who were in the One Health group there at Del Val, you've probably had Rudolf Virchow's words, emblazoned in your brain, how between animal and human medicine, there is no dividing line, nor should there be. So we're talking an old concept that we've kind of lost track of and lost our ability to really tend to. The current One Health movement that we're trying so hard right now to really help people understand, in my mind, started in the late 90s. And it was coming out of conservation medicine and biodiversity and ecology sectors. They were saying, wow, look at all these diseases that we're getting as people that are coming from animals. And that kind of started the conversation. And there are so many zoonotic diseases that have been driving this One Health conversation, all the way from the avian influenza back in the early 2000s. And a lot of people still don't realize that HIV/AIDS started out as a zoonotic disease, and then just look where it's taken us these days. And of course, the first SARS back in the early 2000s, one of the early coronavirus things that we had to deal with, not to mention today, and Ebola and Nipah virus and Zika, the list goes on. So zoonotic diseases is a really important arena that we absolutely need to implement One Health thinking and acting for. And in places like India, we're never going to eliminate human tuberculosis until we've controlled bovine tuberculosis. So this is where the social aspects of some of our interactions with our environments and our animals come into. But we actually have learned over the past 15 or 20 years that zoonotic diseases are not the only area that are begging for this One Health approach. So what I'd like to do tonight, I'd like to think of One Health kind of as a diamond with so many faces. And if you look at any particular facet of that diamond, you'll get a different reflective pattern. But it all goes together to add up to this incredibly powerful, reflective, beautiful stone that I think of as One Health. So let's just touch, kind of like a skipping stone across the water. Let's just touch on some of these just to kind of help people start thinking that there are many arenas that need this One Health. And that's why, as Dr. Hoyt said, it's so important for us to be able to bring every aspect of our educational departments and curricula together to be aware of it. So let's start out, now that we've already talked about that slide, let's start out with animals as sentinels. We really need to be paying attention. When I came out of vet school back in 81, and I age myself a little here, I had never been taught anything about hyperthyroid cat. And in the 80s, we started diagnosing hyperthyroid cats. And a bunch of really smart people, some of them at NIEHS, realized that about the time we started diagnosing hyperthyroid cats was on the heels of when we introduced flame retardants into our environment, things like polybrominated diphenyl ethers. And they did some research, and lo and behold, there was a strong association between those flame retardants coming into showing up in our environment, and when we started diagnosing hyperthyroid cats. So it turns out these PBDEs are very powerful endocrine disruptors, and they were affecting the cats because what do cats do? They sit around on warm surfaces like the old computer towers we used to have, or the tops of TVs, those hard plastics. And those hard plastics had been impregnated with PBDEs and outgassing and getting in the dust. Cats sit around grooming themselves, and they were getting high doses of PBDEs. A study was actually done over at Duke University by Heather Stapleton and her group, looking for this in children. Now, we used to put PBDEs in children's pajamas as a flame retardant. We thought we were doing wonderful things, but these things turned out to be endocrine disruptors. And now we have found it in children and very small infants, especially what I call the rug rats that are crawling around on the carpets that have been impregnated, and the upholsteries and all our household goods have been impregnated. So we don't put PBDEs in children's pajamas anymore. But we have realized that that is a prime example of how animals were really sentinels for what we were being exposed to. And a similar thing has happened with parallels in cats with perfluoroalkyl substances, the PFASs that are in so many of our cooking utensils for, surfaces for decreasing friction. And in our frying pans, we've had to start trying to make sure we don't have PFAS in our frying pans. And CDC's done some studies on this. It's very discouraging and frightening because they found it everywhere in waterways and human tissues. So animals were our sentinels for how that happened. Some of the stories that I really like to share, and I hope you guys will take a chance to take some time to go and look at this YouTube video that I've got a link at the bottom here too. My colleague Tracy McNamara did this video about human canaries in the coal mine. And she tells these incredibly convincing stories about how in our current systems, with absolutely no mechanisms in place in this country and in many places around the world for I like to use, if I'm talking to a lay audience, I like to use rapid disease detection in wild animals, because the word surveillance conjures up all sorts of concerning things. But in the scientific community, we're talking about syndromic biosurveillance of wildlife and companion animals that our structures are not in place for. Now we're starting to see a little more recognition of it, but our funding structures have not really have not supported this at all. So what's been happening is we've been kind of using humans as the canaries. And as Tracy points out, we're not going to find an emerging zoonotic threat in the United States until we have people in emergency rooms and bodies in the morgue. And she tells a really interesting and compelling stories about this, about how she helped identify West Nile when it came into the country in 1999. And that's what that little YouTube is about. But there, more recently, in 2017, there was an outbreak of influenza in a cat shelter in New York. And nobody thought much about it. It went through the shelter and all the cats got sick. But lo and behold, the staff there, the veterinarians there, got sick too. And before they figured out what was going on, 300 families had adopted cats from that shelter. Now, just stop a minute and think, what if that had been a variant of influenza that had gone wild like 1918? In other words, we might have dodged a bullet. In fact, I think we dodged a lot of bullets. So because we didn't have systems in place for identifying West Nile, it took us 3 or 4 weeks to figure out that West Nile had come into this country. And what if that had been something that had gone around the world like what we're living now with COVID? So we have a lot of things that I hope everything I say tonight to you is going to impress upon you the urgency of what we're talking about here. So our systems, many things have changed today with our global transportation around the world, but our systems have really not caught up. So what we end up doing today is using taxpayers as sentinels for these, and we really have to do better than that. We've got to think about this and put systems and structures in place that can address if we found an emerging zoonotic disease, or even if some of the diseases that we know about showed up in places we were not expecting them. So antimicrobial resistance, of course, is the essential One Health issue. Yes, bacteria have been evolving for eons, and they do it naturally, whether they have been exposed to antibiotics or not. But we, with our use of antibiotics, have really sped that process along. So as you guys know, there's a huge discussion, and we're starting to see great activity at all around the world about how we can curb and control antimicrobial resistance. And if you're reading this slide, this is from 2016, when we thought there were maybe 700,000 deaths around the world to antimicrobial resistant organisms. I read a piece just the other day. A study had been done to evaluate just the bacterial antimicrobials that are failing. And they're already thinking that in 2019, there were 1.27 million deaths to people around the world just to antimicrobial resistant bacteria. So we've got some serious work to do. One of my colleagues wrote a little book, One Health and the Politics of Antimicrobial Resistance. Dr. Khan as a true One Health sister. And in the 5 years she spent researching that book, she came upon two kind of mind-boggling ideas. First, we live with our animals. We share our microbiomes with those we live with, including our animals. Some people sleep with our pets. And we weren't paying any attention to antimicrobial resistant organisms in companion animals. I think CDC has since done a study on that. I haven't heard results on that, but we're starting to think a little more about things like that, our microbiomes, and antimicrobial resistance in the environment, how we are just starting to wrap our brain around the residues of antibiotics that are in our environment and the antimicrobial resistant organisms that they're exchanging their little resistance cassettes in their DNA strands because they're mixing together in the oceans and in our environment. We're just starting to realize the impact of this. I mean, I realized only a few years ago that these fish farms are using a lot of antibiotics because it's just like the livestock industries and intensive farming there. Animals are being crowded together and having to use antibiotics to keep them healthy. And now we're just realizing that microplastics that we have contaminated the entire globe with are turning into hubs for pathogens and antimicrobial resistant bacteria that are adhering to these microplastics. So, oh my gosh, just think about this is our human impact on the environment in multiple ways. And sometimes we can talk about the interconnections of the interconnections and then how these antimicrobial resistant organisms are affecting our environment. And it can go both ways, things that antimicrobial resistant organisms that humans get, which we do see with methicillin resistant Staph aureus, which is more common in humans, but can pass to the animals and then back and forth from animals to humans because we share our environments with our animals. So we're starting to really have to think about our shared microbiomes and shared environments and how antimicrobial resistant organisms can pass back and through. We're seeing antimicrobial resistant organisms in marine mammals in the middle of the ocean who have never been given antibiotics because our oceans are in some ways turning into cesspools of all the sewage drain off from countries that still have over-the-counter unrestricted sale for antibiotics with use unmedically supervised use of antibiotics. So we have a lot of work to do. And I didn't realize until a few years ago that we actually use antibiotics directly in the environment in some of our citrus crops. Now, I know this has been looked at and studied, and they've assumed it's safe or it wouldn't be approved. But I'm wondering, are we really looking at what that's doing to the soil microbiome? We're just starting to realize that these antimicrobial resistant organisms can affect the rhizosphere or the plant root, and it can affect the nutrient uptake, as can climate change, can affect the nutrient uptake of plants. And we're just starting to realize that the microbial community in the earth and in the ground and the soil is just as important as the microbiome in our guts. And we all are beginning to learn just how important that is for our immune response. So, and just one other little thing, it's pointed out that we don't have a standardized methods for measuring antimicrobial resistance across countries around the world. So we may be comparing apples to oranges when we're trying to talk about this. So much work for us to be doing in this One Health space of trying to make sure we're working together across discipline to address antimicrobial resistance. Comparative biology, comparative medicine, translational research, many people don't understand that pets, dogs, animals can get the same disease processes as humans. Yes, animals can get diabetes. Glioblastoma multiforme is exactly the same in dogs and humans. Osteosarcomas, the progenitor cells of osteosarcomas are exactly the same. Whether you took that osteosarcoma from a human or a dog, exactly the same. You cannot just delineate the DNA fingerprint of these cells. So much work for us to be doing to pay attention to what we can learn from each other. Maybe some of you are following the news recently about the xenotransplantation of the gentleman, David Bennett, who received a genetically modified pig's heart. So now he's still living. He's still with us now, 2 or 3 weeks later, with his genetically modified pig's heart. So we've spent many, many years learning from the veterinary world has spent learning from the human community, but that hasn't gone so much the other way. And so we're just beginning to realize we have a lot to teach each other, but we've got to form the structures and the systems and relationships that allow that to happen. And I'll just mention this book, Ubiquity, in passing, because some of you might really find it interesting. Barbara Nettison Horowitz and her colleague, Catherine Bowers, wrote this several years ago. And Barbara actually calls it her love letter to veterinarians. She's an MD cardiologist who realized that many of her MD colleagues had no clue of so many of the same disease processes and psychological challenges that are seen in the human world are also seen in the animal world. And she realized that many times the veterinarians had found ways to deal with these patients who don't talk. And that there was a lot that we could learn from each other. They've actually been leading Ubiquity conferences now for a number of years. So I urge you to check out Ubiquity. You'll find Barbara's now at Harvard. She started out at UCLA. So just making you aware of some of the places you can go and learn more information about comparative medicine and translational research, a huge area begging for this One Health conversation. Disaster preparedness and relief. Oh my goodness, how many times are we going to have to learn this lesson to not put these animal facilities in places that can flood, and look at the public health disaster that can happen when these hurricanes hit and we have natural disasters. And we're starting to realize we have to think about what's going to happen to the animals when these disasters hit. Just think of all the animals that died in Australia a year or so two ago when the wildfires were so out of control. These disasters impact the environments and the animals, and we have to be planning in a One Health way ahead of time, making sure that all the players are at the table when we're putting our emergency response, our disaster preparedness protocols in place. And Katrina in 2005 taught us a huge lesson. They estimate that 300 people died because the owners, the people on their rooftops, would not leave when the rescuers showed up, because the rescuers were not authorized, did not have pet carriers to rescue the animals too. And they were asking the people to leave their pets on the rooftop, and they wouldn't do it. And so people died. So we learned this lesson: do not show up without pet carriers in a disaster. And we're starting to see more and more the planning ahead of time for what's going to happen to the animals in these disasters. One of the really, and this is again some work of my colleague, Dr. Laura Kahn. She's written a little book back in 2009 and just recently re-released, Who's in Charge? And it's written from a One Health perspective, because she makes the case that, during the health crisis is a really bad time for our local officials and our health officials, our national leaders, to be exchanging business cards. They need these relationships in place ahead of time. And she actually looked at case studies of a number of cities that had met metropolitan health crises and actually evaluated the ones that had these relationships in place ahead of time. And they fared so much better than the ones who didn't, who were trying to figure it out as they went along. And I'm afraid we're kind of living that right now in the past couple of years with COVID. These relationships have to be in place ahead of time, and they have to be strong and resilient. Food and water safety and security. We're just skimming the surface here, guys. We could talk for hours about all of these topics in a One Health framework. So I'm afraid the take-home message for me is that I think we're going to have to really rethink a lot of our food systems, because I think that our food systems are going to really challenge us, and they're going to come back to bite us in so many ways. And just examples of places where we have to be thinking of food safety is Salmonella and Campylobacter in backyard poultry, and educating the public and making sure they're aware of the zoonotic issues and how to stay safe with their backyard poultry. It's wonderful that they're doing backyard poultry and raising eggs, but they really need to be educated about staying safe from things like Salmonella. And we could talk for hours about most of these things. I want to pause just for a second, because I love teaching One Health with stories. And this is a true story that I lived. It's on the water safety. So the little guy here on the left in red is my little guy about 33 years ago. And when he was just about 20 months old, he was about to potty train. He got this horrible chronic watery diarrhea. It lasted for 6 or more weeks, and it was extremely contagious. My husband and I both got it. We were so sick, we couldn't lift our heads off the pillow. We had to take turns taking care of the baby. And when I would take him to the pediatrician, they didn't seem overly concerned. So finally, we were getting worried, because our little guy was getting dehydrated. We thought, oh my gosh, are we going to be hospitalized? Little eyes were sinking back into his head, and potty training went right out the door. So we were both at the vet school at NC State at the time, and my husband, also a veterinarian who was on faculty there, finally took a soil diver into the parasitologist. And if we were in a room together, I would ask for a show of hands or some suggestions as to what this might be. Unfortunately, we're not in a room together, so I'll just have to tell you, this turned out to be Cryptosporidiosis. We do not know where our family got this. My husband and I, neither of us were working with any large animals at the vet school. We had company the week before my son got sick, and they had mentioned that their kids had been sick with diarrhea. We had been on a vacation together. We've been in swimming pools. So, Cryptosporidia is very often a waterborne zoonotic disease. And nowadays, I would hope that pediatricians might hone in on this or be more alert, because what if this had happened in a household with an HIV/AIDS patient? That's how we really learned about Cryptosporidia, is it was killing so many AIDS patients. So it could have been devastating had we had an immunocompromised person in the household. We finally got rid of it when we got rid of our hand towels, our cloth hand towels, and put paper towels in the bathroom and started being extremely fastidious. And of course, over time, your immune system deals with these things. But this is just a One Health story that is so profound, because our health systems are often not tuned into some of the things and don't often know the right answers, right questions to get the right answers, to get to a diagnosis quickly and in a safe way, so things can be alerted, like households can be alerted. The human-animal bond, just another area. I love the antidepressant slide here. And if you can see this middle slide in the bottom, a warning, tick-infested area. If we're out on hikes and our dog is with us, and our dog goes into this tall grass, and then we get home and it climbs in bed with us, and we're living very closely with our pets because of the human-animal bond. We have to think about the common shared environment and how we're sharing the pathogens in those environments too. And things like Lyme disease and babesiosis and Rocky Mountain spotted fever can very easily transmit to us through similar pathways. And it was human-animal bond and pocket pets that brought monkeypox into this country. So that's back in earlier than 2003. And just recently, CDC's been dealing with outbreaks of Campylobacter that they think were coming from puppies in pet stores. And we now know that we've had problems with salmonella. We always have known about reptiles of any sort, but there's been an outbreak related to bearded dragons and also to pet hedgehogs. So our companion animals, our human-animal bond, can be a very powerful driver of our exposures and our interactions with our animals. And we have to be paying attention to some of precautions that we need to take, not to be afraid, not to be afraid to have pets and live closely with our pets, but just to be aware, be educated. And this is not just the companion animals. If you think about the early 2000s, when there was a foot and mouth disease outbreak, not a zoonotic disease, but a lot of animals were having to be destroyed. And we had farmers committing suicide because some of them had spent their entire lives breeding a certain line of animals, and they'd have to watch them all be destroyed. So very powerful bond and very, very strong implications for things that we need to be aware of. And one thing that I want to mention is some of you may be familiar with the National Link Coalition that has really worked hard for years now to highlight the link between animal abuse and domestic violence, because we know that in those social environments, if animals are at risk for being abused, people are too. And there have actually been some programs launched to help us understand and really address both ends of the leash when we're talking about domestic violence. And I could tell you story after story about how this link has been so incredibly important, because in situations where domestic violence victims have pets and their abuser has threatened to kill or hurt their pet, they won't leave those abused environments because they're worried about their pet, and they know that shelters wouldn't take their pets. So many shelters are starting to rethink that and find ways to take the pets, or find ways to place the pets in safe places for the owners and hold them, if not in the shelter with them, find places for the pets to leave those abusive environments too. So that's just some of the work that's going on in the National Link Coalition, and our awareness raising about this link in these social systems and these social environments. Non-communicable diseases, another area where we need to be paying attention, aflatoxins, diabetes, many mycotoxins that are, some of us are being aware now of the mycotoxins that are released into our environment, and mold and mildew situations, many times in rental housing where people don't have anywhere else to go and they're being exposed and it's making them sick. These are non-communicable diseases that are right here in the health space. I hope some of you will go and look at this YouTube video, Eric and Petey. It's a wonderful story about this gentleman who was 300 pounds overweight and was literally headed for the grave. His doctor told him to go get a burial plot. And so he's hooked up with a nutritionist who told him to go adopt a dog, get an old fat dog, and both of them work on themselves together. And he did. And he asked now, did PD rescue me, or did I rescue PD, or did PD rescue me? Because their bond and their working together saved his life. He truly believes that. Another story I love to teach One Health with stories. This is about this is a true story that's actually been shared by Dr. Robert Miller in his column in Mind Over Miller. It's a story about his daughter. So this is a published story. This is not his daughter's image. This is an anonymous image, but she was a journalist. And so she went off to South America and had a fabulous time going up the Amazon and, climbing mountains. And she came back from this wonderful journalism trip she took. And a couple of weeks later, she had really strange illness. She had swollen, painful joints, fever, and skin lesions, and weird things like discolored fingernails. And when she went she had shortness of breath. And when she went to the doctor and they did radiographs, she had lung lesions. One of the most concerning things they found with their workups for her was that she had granulomatous visceral lesions along her intestines. So that was concerning because it could be gastrointestinal stromal tumors. So long story short, 2 years, 76 specialists and 10 CT scans later, she'd been given a number of tentative diagnoses. They still didn't know for sure what was wrong with her, but they were concerned about these masses. So she was scheduled for an exploratory surgery to go and find out what these masses were. And about that time, her dad was at a veterinary meeting and he was telling some colleagues what was going on with his daughter. And one of them said, oh, she's probably got a parasitic disease. She needs to take some ivermectin. And another one said, well, she's probably got a vector-borne disease. She needs to take some doxycycline. Well, they talked her doctors into sending some samples to Dr. Ed Brightsword at NC State, who has for years run a vector-borne disease lab and a intracellular pathogens research lab. And again, I wish I were in a room with you. Could I ask you for a show of hands or some suggestions as to what this is? But I'll just have to tell you, they found Bartonella vinsonii. Now we're going to pause for just a minute and talk about Bartonella just a little bit. To finish that story, they did the surgery because she was already scheduled when this results were coming down the chute. And the surgeon came out afterwards and told her dad in the waiting room, well, we didn't see any signs of a malignancy, and that's good news. And her dad said, yes, but I don't think I never thought she had a malignancy. I think she has Bartoniolosis. And the surgeon looked at him and said, I'm a surgeon. I don't know what Bartoniolosis is. Now, guys, this is not bad on the surgeon. It's bad on our systems. We need better ways to exchange information across our professions. What if the radiologist reading her x-rays early on was aware of her, first of all, of her travel history, and second, of what she could have been exposed to, and third, that some of these vector-borne diseases could cause these kinds of lesions. Just think of not only the money that could have been saved, but the mental anguish and the illness for 2 years that this young woman went through. And once they found out what she had, she was treated and did fine. So what is Bartoniolosis? A lot of people think it's a hidden epidemic. Some of you may know it as cat scratch fever. It was the causative organism for trench fever in World War II, probably being vectored by body lice in the trenches. And so Dr. Ed Brightsword has been working for years. He's a veterinarian at NC State who was first working with Bartonella and recognizing Bartonella more and more in animals. And then he started having, especially veterinarians, when he would be telling at meetings, he would be telling the story about how these animals were affected with Bartonella, and veterinarians were coming up to him afterwards saying, oh my gosh, could you test me for Bartonella? Well, he did hook up with Dr. Robert Mosiani, who was an MD, and they did a lot of studies together. One of the early ones was published back in May of 2012. They had Dr. Mosiani, he's a rheumatologist, and he had been seeing a lot of patients who thought they had rheumatoid arthritis, or they might have thought maybe they'd been treated for Lyme disease and hadn't gotten better, or they thought they had chronic fatigue or fibromyalgia. They'd been given all these different diagnoses. So he started sending some blood samples to Dr. Ed Brightsworth's lab. And a couple of years later, they thought, well, we should stop and see what we've got. And I hope everybody is sitting down, because 41% of his patients actually had Bartonella. They were harboring a species of Bartonella. And since then, one of Dr. Mozziani's colleagues out on the West Coast has been also why he was working with a lot of fibromyalgia patients, and was finding a high percentage of his patients were also coming back positive for Bartonella. Now, this is an imperfect science. It's an emerging field, and the testing is getting better and better. But I think this awareness raising is so incredibly important, because this is a vector-borne disease. It's vectored not only by almost every disease, every species has its own version of Bartonella. So it's vectored by a lot of different vectors, from biting flies and midges to ticks to fleas. The Bartonella henselae and I think Vinsonia is from ticks. It's brown dog ticks. Bartonella henselae is the one that's vectored mostly by cat fleas. So we're finding that this is really showing up as neurological manifestations. Here's a child that had Neuropsychiatric Syndrome. There's a concern for blood donations. It's actually been identified in donor blood in Brazil. A huge concern that it's a huge occupational risk, as many things are for animals, people who work with animals, veterinarians and veterinary technicians, and livestock workers. And then one of the most interesting that I've become aware of is this radiograph and these red dots you see here. This is a veterinarian who had to have a hip replacement because of degenerative arthritis. And they actually harvested the femoral head and looked for Bartonella in the bone matrix of the femoral head. And yes, it was there. This person had had Bartonella for so many years. It was so deeply embedded in all this person's tissues that they were actually finding it in the bone matrix. So the ramifications of this, really not an emerging disease, but a disease we're getting emerging information about, that's being shared across the human arena and the animal arena, and there are people who are starting to work together on this, is so incredibly important. And this young lady and her son, they have also lived this One Health story. This is Amy Labeouf and her son, Jack, who as an 11-year-old was a vibrant, track running young man. And they put this story together through the years. One day he was scratched by a stray kitten, and became ill not long after that. He went from being, a track runner to a wheelchair to a hospital bed in a matter of months. And, it took like 2 years before they figured out that he actually had Bartonella. And it was this mother, this very diligent school teacher mother, who actually discovered Ed Brightsworth's work, and he hooked her up with Mozziani, and they got him on the right therapy. And 5-6 years later now, this is Jack. He's doing fine. But some of her teacher colleagues, at least one I know of, lost a son. They knew he had Lyme. They had tried to treat him for Lyme. And just before he died, they found out he also had Bartonella. So that was too late. They were unable to save him. He was 26 years old. So these are some really life-changing, life-threatening issues we're talking about here. This gentleman is an amazing One Health champion, Neil Spector, who also lived a One Health story. He went 11 years undiagnosed with Lyme disease, and it damaged his heart so badly he ended up with a heart transplant. He's a neurologist. He worked in the medical community, and this happened to him. He understands how the medical community works, and this happened to him. And he was not bitter about the diagnosis being missed, but he realized just how far we have to go. He actually wrote this book, Gone in a Heartbeat. I challenge you to go read it. It's very fascinating. So these are stories right at the intersection of the environment and humans. So I'm going to have to go really fast. Diseases absolutely are another one of those kind of interconnections of the interconnections, how vectors are changing their regions because of the changing climate. They're moving, ticks are moving into areas they never were in before, and how we could be only paying attention how finding like Lyme disease titers in dogs when we do our heartworm tests in them. Could actually, if we paid attention, that could show us where the Lyme disease is, the people are being exposed to Lyme disease. This is a CDC Lyme disease map in 2018 on the left, and a companion animal companion animal parasite council, Lyme disease being found in dogs map on the right. Can we pay attention to how we could use these animals as sentinels? But we're not. Letting the humans be the sentinels. And so we've really got to think about the systems we can put in place to allow us to really pay attention to what's going on in our environment and the animals. And now we're living COVID, oh my goodness, from March of 2020, when it was, just really starting out over in China, to watch how it marched across the globe, then to be so embarrassed because of the United States being the reddest country on the map. And now to the United States having the most deaths, over 75 million cases. And it's just so horrendous that we've not had systems in places to prevent this. We've got to find those systems and put them in place. And disease detection in wild animals is being done in a lot of places around the world. We're not going to have time to talk about a lot of them. But in years in my lifetime, we never had seen mass graves like we were seeing in New York early in the pandemic. And I'm just praying that we don't get to that point, as we've been going through this winter surge with Omicron. So one of the things that the One Health Commission noticed early on is that there were popular media op-eds and commentaries coming out all over the world calling for One Health, talking about the COVID-19 pandemic and how it had come about and how we really need One Health. So I urge you to go take a look at this webpage. There are like 300 or so of these, and it's a little unusual that we're showing you popular media op-eds and commentaries. There's tons of scientific papers, but the public is not reading the scientific papers. The public is reading the popular media op-eds and commentaries. So go and take a look at them. It's pretty amazing. And it turns out many of these can be profound teaching tools for lawmakers and policymakers. So we cannot blame the pangolin or any other animal. This pandemic is of our doing. It's our human and cultural activities that are putting us in close contact with animals. There's a huge conversation about the wet markets, and we're starting to really pay close attention to how there's some cultures that are absolutely dependent on wild animals, bushmeat for their nutrition, not to balance these systems and put regulations in place that protect people. But first we have to become aware. This is just an example of some of the things on that page. Nature is not the enemy. We have seen the enemy, and it is us. So we really do have to make sure that we are putting systems and practices and protocols in place that can let us not ever have this happen again. Because, think about things. Now we have COVID-19 and deer all over the United States. And the concern here is that the deer are going to become a kind of an incubation place, a reservoir for SARS-CoV-2 to mutate and then possibly jump back to people. So, the ramifications of these things are mind-boggling for us to be now so quickly into this pandemic, to have it. And we really don't know yet how the deer got it. They don't know, because usually when hunters are in contact with animals, if the animal has already died, it's postulated that maybe some shelter, some animal rehabilitators could have given it to the deer and then released them into the wild. These interconnections of our environment and our people and our animals are just amazing. It's going to cost so much money. It's been estimated that our global expense for this is going to be up to $24 trillion. The economic impacts are just mind-boggling. And so why is One Health so urgent? Because we're not ready. Some pretty famous people have been telling us that we're not ready for quite a long time. So Ebola was a wake-up call for us. I know Gates Foundation had to put some money toward getting PPE to the places where Ebola could be managed. So we were not ready. We're still not ready. And some of us wonder if the the numbers could help us really get there and help us understand the importance of this. And we've got a whole compilation of all the publications that have come out about the economic benefits for One Health. So I urge you to go take a look. I'm going to have to speed forward here now because I want to tell you a little bit about the good news. What can we do? most of us agree we need to do this. So, obviously some of you are familiar with our Global One Health Day that we launched in 2016. We were blown away the first year at all the events around the world. This is just like a visual of where One Health is being embraced around the world. And we've had celebrations every year since, including in 2020 and 2021. In the pandemic, people still finding ways to teach about One Health and educate about One Health, and especially teach locally and teach lawmakers and policymakers. And I get to see groups forming up all over the world, like the Latin America One Health Ibero and Caribbean group. It's been one of the most fun things I've gotten to do is work with creation of an International Student One Health Alliance. Very exciting. And then all of these things that have happened just last year with G7 and G20. I hope you'll go back and look at these slides, guys, because there's so much information here, how One Health is really coming forward now at an international level with FAO and OIE and WHO, often known as the One Health Tripartite, and the UNEP, United Nations Environmental Program, is now stepping up and getting involved. So popular media op-eds are coming out and really pointing out what happened at the G20. And then because, the mention of One Health and calling One Health out, we have a One Health high-level expert panel that was actually launched by France and Germany in collaboration with the One Health Tripartite. And they're actually have recently released a new definition for One Health. I wish I had time to share that with you. Back in 2021, PAHO released a One Health policy statement. We had this incredible report come out of the high-level independent panel advising the G20 that was calling for One Health all through that report. Of course, in September, when the G20 actually met, we were getting a call for action coming out of the G20, other people calling for invest in animal health or risk undermining global health. At the One Health Summit, it was mind-boggling last year. At the One Health Summit in October, there were 6 sessions on One Health. So I urge you to go and check out some of the links here. I actually compiled the sessions into a place for our ease of seeing what all was going on at the World Health Summit. Our CDC, as you guys, some of you probably know, we have, starting in 2009, we have a One Health office at CDC. It doesn't have any, don't get me wrong, there is absolutely zero budget line item budget dollars for One Health anything in our countries, but we have many people in our agencies who are trying very hard to work in a One Health way. Fabulous things going on with the CDC One Health program. They do a really interesting Zoho call. If you've not learned about those, you could tune in and hear about current thinking. A federal interagency One Health working group has been very loosely organized for many years. Dr. Casey Barton-Baravich at CDC One Health office is actually leading that now, and they have a very active One Health COVID-19 collaborations group that's really been working across all the agencies to help plan and address COVID-19. Now starting to look for paying attention to COVID-19 in animals, and of course USDA has a lot of funding to start doing that. So we're hoping that some of those programs are going to morph into true, rapid, syndromic, species neutral surveillance programs for wildlife and companion animals. Here in the US, APHA and AVMA, a lot of organizations are really starting to embrace One Health. More and more health departments around the US are starting to put One Health programs in place and have One Health conversations across their, I'm gonna have to skip this one because we're not gonna have time to go into it. Many states are starting now to proclaim One Health Month or One Health Day. And so we're getting that kind of awareness at state levels. New Jersey actually last year was the first state to legislate a One Health task force. And they're now figuring out just how they're gonna to really do that in a very highly productive and effective way in the state of New Jersey. In 2019, when the One Health Act that's currently in front of Congress was first introduced, we actually put together a US coalition, a very informal coalition of US supporting organizations. Would love for you guys to consider if DelVal would like to be added to the academic institutions in support of One Health. Very informal, but just kind of a way to keep us all informed and aware. Of course, that bill in 2019 was the first to be introduced in a bipartisan way in both chambers. It didn't get out of committee. It was reintroduced again in March last year in 2021. Still hasn't gotten out of committee, but I promise you we have a lot more lawmakers who are understanding hearing the words One Health and understanding it now. So we have a long way to go, but we're making a lot of progress. And at the end of last year, I'm still kind of struggling to see what made it through, but our National Defense Authorization Act actually had the entire One Health bill addended, along with Senator Feinstein's office offered an amendment trying to create a One Health office at FDA. So we're getting some traction, some recognition, some awareness. We still have a long way to go. I want to be sure you guys are aware of this outbreak exhibit the Smithsonian created. It was actually launched in 2018. The pandemic has made it lose a year and a half or so of being available to the public. But what I really want you to know, if you can't get to DC to go to the Museum of Natural History and view this exhibit travels. So you could actually communicate with them and they would give you free of charge all the panels that you could, all you'd have to do is come up with the funds to have them printed in whatever your favorite format was, and then take this exhibit to a library or a shopping mall or a hospital lobby. So I urge you to think about doing that. This is obviously not all the faces of One Health because it's just focused on zoonotic diseases. It starts out with the 1918 flu pandemic and walks you through so many of the challenges, HIV, AIDS, and Nipah and SARS and MERS and Zika. And so I urge you to pay attention and maybe go check that out. So here at the commission, we work really hard to, as I say, connect, create, and educate. I hope that you'll go and add yourself to the listserv because it's just one of our ways. We put out this One Health Happening newsletter that's become really quite popular around the world because it's helping us see all the things that are going on for One Health around the world. One of the things we do is we actually have a who's who in One Health. And by the way, the Delaware Valley One Health group is on the academic page. So go and check that out. But we had so many groups and organizations around the world working for One Health that we had to split them out into academic, government, nonprofit, and corporate. So go check that out. We have a wonderful opportunities page. You can actually submit your opportunities yourself there or go and just check out what's been submitted. So I hope that especially any of you students that are looking for opportunities will look at this opportunities page, both here and on the International Student One Health Alliance page. They also are looking for opportunities. You know, we so desperately need the social scientists, the economists, the anthropologists, the psychologists, the behaviorists to be involved in all these One Health conversations. So we actually have a One Health Social Sciences initiative. I hope you'll check their webpage out. Actually launching small working groups right now to give more and more people opportunities to get involved in this One Health conversation. We have a very active One Health education group trying to find ways to take this One Health education to young children. We have a bat rabies team that's been trying because there was a gap. Nobody was teaching children and parents not to touch a bat. We don't want to be afraid of bats. We need bats. Don't hurt bats. But if you see a bat on the ground, don't touch it. And I can tell you story after story of people who didn't know what it did had exposure. And this happens just at the end of last year. Here in the US, we had 5 deaths related to bat rabies because people didn't know. So go and check out that. We also just recently launched our first One Health scholarship. It's with the Georgia Aquarium in honor of Dr. Gregory Bossert. I hope you'll check that out. Just gave out our first scholarship this past fall. And we've recently launched, I hope you'll check this out, especially if any of you work in public health. We recently launched a resource on the website, One Health Education Resources for public health educators. So that's a very powerful resource if you want to go check it out. It's actually targeted and kind of framed for public health educators. So please do check it out. Coming soon, this is a sneak peek. You are the first audience I have shared this with. It's not available yet, but these are 3 web pages actually that are about to be launched. One Health is all the countries. One page is all the countries that have One Health strategic action plans that have been adopted. And then there's also a lot of countries that have adopted One Health framed antimicrobial resistance strategic action plans. That's very exciting to pull all that together. And then another page that is just being formed right now is a whole page of One Health toolkits that are available all over the world. So keep an eye out. That'll be coming soon. We launched One Health Awareness Month a couple of years ago. We've just come out every January as a One Health Awareness Month. And I know Reg is just giving me the red flag now because time is up. And he really wanted me to save time for some questions. So I hope you'll go and maybe look at these slides that I'll make available as a PDF to Reg. And I hope that you'll find something here that we've said useful. Again, it's the collaborations that we need are not going to start if we stay in our silos. We have to step out of our comfort zones and go and make relationships and collaborations outside, because One Health is a truly powerful solution for today's challenges. And we may be approaching a tipping point. We're not quite there yet. So we need everybody to really help us with this. So thank you so much for listening. And I am very happy to stick around and answer any questions that you might have. So with that, I'll turn it back over to Dr. Boyd and stop sharing my screen.
Thank you so much, Dr. Stroud. That was great. And we do have a couple of questions that are down in the Q&A right now, but I encourage other folks to add your questions as well. We'll take a few minutes here, a little bit beyond our end time, but I think that this is kind of important and we'll stick through it. Actually, I have two questions from Claire. So Claire's first question is, was hyperthyroidism not present in cats prior to the exposure to PBDEs, or was it a surge in prevalence? How do scientists make these seemingly improbable connections?
So to my knowledge, we had not been diagnosing hyperthyroidism in cats at all until the late 80s. It was a new phenomena for the veterinary world to be seeing this in cats. So it took some very astute observations to put that correlation together. And it turned out to be a very strong association. And then we started looking for it in cats and people. And then we realized those endocrine disruption connections. So yeah, that's a good question.
And Claire also asked, do you have suggestions for breaking down some academic silos for better collaboration across disciplines?
Oh, I want to see more programs like what you guys are doing. Texas A&M has also been trying to do this across the campus, across all the colleges and departments of the campus. It is not easy, guys. We need to see more awareness. Not only, I mean, I always tell people start with the students because the students might drive it. But it's kind of a top-down, bottom-up thing. We see this at government and in local One Health activities, but it's also at universities. It needs to be a top-down, bottom-up. So you get students really talking about it and faculty and excited and understanding it. And then your administrators will come along, because you're really lucky if you've got an administrator that gets it and wants to help do these things. But often they're just so busy and they don't understand that it's not something that they are well grounded in. So I think patience is our virtue here, and the top-down, bottom-up approach. And I want to see more programs like what you guys are doing. So kudos to you guys. And I hope more and more of your faculty, especially from some of the lesser recognized disciplines, especially the social scientists, the economists, we really, really need them. And if we can start showing them some of the dollar signs about how we could save so much money if we could prevent a pandemic, maybe that will get, if we can't get attention with saving lives, see if we can get attention with saving money. So I'm serious. Take the dollar signs to your administrators. Say, look, if we can educate, if we can get our students prepared, we can get systems in place that can prevent these kinds of zoonotic outbreaks.
And we have an anonymous question here. Do cats still get hyperthyroidism since the cause has been identified and eliminated?
We do still identify and diagnose cats. When I left practice a few years ago to lead the commission, it was not unusual for me to diagnose. It's usually the older cats because they've been sitting around on these surfaces longer. It'll be a real interesting thing. I cannot tell you if we've started seeing an improvement yet, but if you think about it, a lot of those materials that were introduced into our environment are still there. The flame retardant carpets and the flame retardant upholstery fabrics and the flame retardant curtains and a lot of these flame retardants are still in our environments. And I don't know that there are a lot of studies, like the CDC did a real big study on PFAS, but I don't know if we've got very robust studies looking for PBDEs in the environment like we did for PFAS. So there are so many arenas that are begging for us to really pay attention.
I just want to point out to the listeners, so Pennsylvania does have a One Health task force, and that task force started out within the Department of Ag, but then connected the Department of Ag with Public Health. I have an an animal joining us here.
That's all right. Let them join.
Public health, wildlife people looking at environmental sides of it as well. And I believe that we were one of the first academic groups to kind of come into this. That group has grown. We have regional meetings of One Health Task Force. So within our region, we are pulling in Delaware, Maryland, New Jersey, New York has just joined in us, and Virginia looks like they're going to join as well. So all of these groups are now starting to look at not only their local issues, but are taking more of a regional approach to looking at this.
And just connecting the health professionals and the non-health professionals that you need to have around the table, connecting them across the state. Like some of the health departments are starting to try to do One Health conversations where they reach to their health departments and they talk about brucellosis or some One Health topic. So much to be done. And I've been watching your Northeast Regional One Health Coalition or whatever you guys call it, because it's one of the first regional groups in this country.
It's a pretty active group. They've been having pretty regular meetings, and within the group, within the Pennsylvania Task Force, there's been subcommittees that are also working on very specific issues, and then pulling together information and attempting, and at the moment I'm saying we're attempting to have impact on policy. But again, with more and more awareness and regional awareness, I think that pressure is going to build to actually take some action.
We just keep having to educate, just bring the information forward and don't get tired. We just have to keep swimming.
So kind of the watchword for conservation of all kinds. And one of the things that I'm really interested in, I know that the One Health Commission has a social science group as well. And one of the things when I think about One Health, go beyond maybe the threats that we are facing to also recognizing the benefits that we receive. I have cats, as you already saw, and certainly those cats bring me a lot of pleasure. They lower my blood pressure. We know that there's a lot of benefits that come from having pets, as well as potentially having some threats from them. I think about, even the environment, that getting out into the environment. There was a pretty well-known book, The Last Child in the Woods, recognizing that those children who play in the woods and get out do better in school.
Doctors are actually writing prescriptions for outdoor time now because our children these days do not get exposed to nature.
Yeah.
It's called nature. They coined a term for it.
Nature deficit disorder.
Nature deficit disorder. Yes.
Yeah. So we're hoping that at DelVal that we can recognize that this is a topic not only for those departments related to animals and to medical health or veterinary health, but also looking at mental health. And certainly economic impacts of both positive and negative, ecosystem services and how those benefit us and our societies. It's a big package, but at the same time, if we can only recognize that we've got one world and one future.
And a lot of people get really confused because One Health is so big, it's kind of mind-boggling, and they think, wait a minute, you're talking about climate change? Wait a minute, you're talking about comparative medicine? Wait a minute, you're talking about... So what I try to help people understand is, yes, zoonotic diseases were the initiating force for this One Health conversation that we're having now for the past 15 or 20 years. But we have realized how so many of our wicked challenges are begging for us to use this One Health approach. So then they go, oh, okay. So hopefully that helps.
I hope so too. And I certainly, we do receive the emails about what the One Health Commission is up to. I share it with all of the members of the One Health working group at DelVal. And for those of you who may not be aware, about 1/3 of the faculty at DelVal are actually members of the One Health working group.
Oh, I didn't know that. That's great. Well, be sure that people go sign up themselves too. I mean, you can forward it, but
yeah,
good if it just lands in their own inboxes. So
Yeah, so do go to the onehealthcommission.org and take a look. There is a pile of information there. I know that we've probably overwhelmed you with a lot of information this evening. Dr. Stroud is going to share her PowerPoint with us, so I'm sure Claire will be more than willing to make sure that that's in a place where everybody can find it. We'll get it up, and the video will be also available. So I think that is about it. We don't see any more questions.
well, I want to thank the 24 people who stuck with us the whole time. Thank you very much for listening.
Well, we thank you very much for your time. And by the way, we did celebrate One Health Awareness Month by a disastrous attempt at showing a video, but then we ended up with actually the video that you suggested, the Earth emergency. And so we had a discussion.
Did you get to show it? Oh, that's wonderful. They've extended it. It was going to stop being live streamed on January the 28th, I think, but they've extended it to February the 27th. I just noticed that on the website today. So it's evidently still there.
Well, I will promote it some more then, because it was an excellent film.
One Health Awareness Month is a little different from One Health Day. Of course, events for One Health Day can happen any time of the year. One Health Awareness Month, we're really trying to kind of do an intensive, help people understand all these many faces of One Health. And mostly it's social media postings and things like that, but it's fabulous if you were able to celebrate that. I'm really glad to hear it. Did you have a lot of students watch it?
Well, we had quite a few that watched it, and it was within a week or so of us coming back for the semester. So it's kind of tough promoting things that late in the month.
Yeah.
But hopefully tonight we'll get them all geared up and get them ready for our next.
There's an interesting story about how One Health Awareness Month started, but we won't go into it.
Well, thank you so much, Dr. Stroud. Thank you to all of you that joined us tonight. And I look forward to seeing more from the One Health Commission. You'll certainly be hearing more from us.
I hope so. You keep it up. You guys go.
Thank you. Good night to everybody. Good night.